right, so good morning. I'm Dr. Gregory Canillas, and I am faculty at the Chicago School and also adjunct faculty at Pepperdine University. And I'm presenting with my colleagues who will introduce themselves this morning.
Hi, I'm Heather Calhoun. I am a doctoral candidate at the Chicago School of Professional Psychology at the LA campus.
Hi, I'm Carly Dickinson. I am also at the Chicago School on the LA campus, and I'm a doctoral candidate as well.
Hi, I'm Melissa Duncan, and I'm a doctoral student at Pepperdine University.
Okay. Thank you. And I think Ebony will be joining us soon. I think she is in the wrong Zoom room, but she'll be here with us shortly. So our presentation is called Family of Origin, Risk and Protective Factors in Romantic Relationships. And I will spend a little time talking about communication and in particular love languages as protective factors in romantic relationships. So I see many couples, and I have a business that's called Soul to Soul in Los Angeles. And we see couples for couples retreats and parenting retreats. And the things that bring people in for couples therapy and couples retreats are these three top things: sex, finance, and so most families don't teach appropriate communication skills to their offspring. Sessions, therapy, and also in my work doing couples therapy sessions, do not come from families where they have really learned how to communicate appropriately. The expression of anger in many families is really what most people know how to do, but not how to communicate their needs. And we found that premarital counseling reduces the risk of divorce by 31%. At Soul to Soul, there are a couple of things that we do to enhance communication. One is the Simmons assessment, which was created by a couple who's married, a psychologist and a MFT. And it asks a number of different questions, and those include things like sex and finances, as well as communication. And so with the couples that I work with, we oftentimes will use the Simmons assessment in order to pinpoint issues that are potentially problematic and that will create conflict in their relationship. And that's also part of the work that I do with Love Wins and with some of the sessions that I do that are community-based. Like for example, tonight we're doing a love languages workshop, the keys to better communication with spouse and partner. I've done it a number of times, and many people, whether they've been, they're newlyweds or they've been married for a number of years, find it to be especially helpful. These are things that they think that they know about their partner or spouse that they don't really know, or they're not communicating effectively. So the 5 love languages include things like words of affirmation, quality time, receiving gifts, acts of service, and physical touch. And again, communicate, the words are not always affirming. I've done abuse, which is frequently, which is very common in families, but is not easily identified. For years I worked for it as a CSW with children who are in foster care, and oftentimes this would come up that people would not really realize that they were abusing their kids verbally, like calling them stupid or dumb, or even gordo. Things that people think are like fun nicknames aren't actually things that people find to be amusing at all. So it's really focusing on teaching people how to communicate and making that more of a protective factor. Questions, comments so far? All right, well, I'll turn it over to Heather. So my colleagues are going to kind of piece together things, I think, different little areas that we looked at that are protective factors. In some cases, they're also going to talk about risk factors to the work, and I'll bring it back to us again on how it relates to the work that I do that's focused. So Heather?
Okay, so I'm going to be talking about marginalized populations and the impact of sexual orientation. First thing we're going to talk about is a little bit of terminology. So if we could go to the next slide. So some of the things that we need to be aware of is different definitions that are going on within the community itself. So first, we're going to be talking about sexual orientation. That is an enduring emotional, romantic, or sexual or affectional attraction or non-attraction to another person. Sexual orientation can be fluid, and people can use a variety of labels to describe these types of sexual orientations. The LGBTQIA+, this refers to all identities commonly associated with gender and sexual identities that are outside of the heterosexual or cisgendered norms. Typically, this is just referred to as the LGBTQ community. However, I did expand it out to what I have here, as that is now the new common term for it. We're also going to be discussing a little bit about intimate partner violence, or IPV. This occurs between two people in a close relationship. You don't have to be married in order to experience IPV. So therefore, it happens in any type of relationship. IPV also includes 4 types of behaviors. This can be physical violence, sexual violence, threats of physical or sexual violence, and or emotional abuse. A couple other terms that we'll be discussing a little bit later on is heterosexism. This is the assumption that all people are, or at least should be, heterosexual. This heterosexism excludes the needs, concerns, and life experiences of the LGBTQ community while giving advantages to the heterosexual community. It is often a subtle form of oppression, which also reinforces the realities of silence and erasure. And then there's cissexism. This is the pervasive system of discrimination and exclusion founded on the belief that there are and should only be 2 genders, and that one's gender or most aspects of it are inevitably assigned to their sex. This system oppresses people whose gender and or gender expression falls outside of the cis-norm constructs. And within this, the cisgendered individuals are the dominant group, whereas transgender or gender nonconforming individuals are considered the oppressed group. So we're going to be talking a little bit about the LGBTQIA romantic relationships. If I could have the next slide. So I'm going to start off with a quote. It says, "Our knowledge of normative developmental issues among the LGBTQI population is limited, as our understanding of these youths in comparison to the heterosexual counterparts." Basically, all those studies based on samples of the general population do include LGBTQ individuals. They remain invisible because the questions are not asked properly. Until scholars in adolescent and youth development can treat these identities as demographically important and include them in all of their work, we will never fully understand the richness and complexity of the lives within the LGBTQ youth or the way that their relationships develop. For the LGBTQ community, romantic relationships come up against a various array of stressors, which include sexual and gender minority statuses such as discrimination, even family disapproval, religious disapproval, things like that. And then emerging adults continue to form their sexual relationship and identities in the absence of relationship scripts for the same, as the same in regards to their sexual and gender minorities, which may cause them to model their partnerships on heterosexual relationships. So Furman and Schaefer explain that in early adolescence development, they develop a sense of themselves within their mothers, their fathers, their friends and family, romantic partners and others. Sometimes they differentiate themselves and it may contradict with one another, their internal beliefs, but these contradictions are not usually acknowledged, they kind of suppress them. So in the middle of adolescence, they begin to recognize their contradictions, and they become a little bit more accepting of who they are and what their type of their romantic relationships they want to be in. So the models that they have within the heterosexual community may be positive ones, but they're very limited in the type of relationships that allow the LGBTQ community to diverge and how their relationships are able to come about. And then for IPV rates, they are reported by individuals whose identity belong in the LGBTQ communities are similar to or higher than those in the cisgender heterosexual women. IPV can cross against all ethnic, social, racial, economic lines, and anyone can be a victim of domestic violence, and anyone can be a batterer regardless of identity, politics, gender, or experience. So the next slide that we have. So as I was saying, we're going to be discussing a little bit of statistics in regards to IPV rates within the LGBTQ community. People who identify as LGBTQ often face increased rates of domestic violence and have a harder time accessing any type of support. 43.8% of lesbian women and 61.1% of bisexual women have experienced rape, physical violence, and or stalking by an intimate partner at some point in their lifetime. And that's compared to the 35% of reported from the heterosexual women. 26% of gay men and 37.3% of bisexual men have experienced rape, physical violence, and or stalking by an intimate partner violence, as compared to 29% of heterosexual men. Transgender victims are more likely to experience IPV in public compared to those who do not identify as transgender. Typically with the transgender victims, they do have, with it being out in public, that's more of public discrimination, as well as just the overall discrimination. And theirs is more outgoing and not behind the closed doors as a typical relationship. In 2012, fewer than 5% of the LGBTQ survivors of IPV sought orders of protection. So that's restraining orders or even leaving the house at the time. And then bisexual victims are more likely to experience sexual violence as compared to people who do not identify as bisexual. So that's just a few slides, stats. So the next thing we're going to be talking about is a little bit of obstacles that are faced by the LGBTQ individuals. So the first thing is screening. As for screening, it is very difficult to figure out who the abuser is versus the victim. A lot of times within the LGBTQ community, there is a concept of what they call the myth of mutual abuse. And this is this describes that even though there may be a power and control and there is abuse actually on one end of the relationship, the victim will express that the relationship was mutually abusive. And because of this, it's kind of hard to determine who is the aggressor versus who's the victim. Within the community, there's also a disbelief or downplaying of the abuse by others within the community. It's kind of the, oh no, that doesn't happen, not in my community, that type of mentality. In the legal system, the definition of IPV does exclude same-sex couples. Legally, the definition of IPV is it has to be a male versus a female or a female versus a male. Not many understand the dynamics of IPV within the LGBTQ community, and they may discount it altogether. A lot of times, police officers also have dual arrests. Police are 10 to 15 times as likely to make a dual arrest in cases of heterosexual ones. So this means 10 to 15 times more they are arresting both the victim and the perpetrator rather than just the perpetrator. And then also within the legal system, there is a higher rate of mutual restraining orders. The next thing obstacle that they face is the heterosexism and sexism, or cissexism. And this can be an added source of the victimization. This has the sayings of you deserve it, or it serves you right, you brought this upon yourself. It's these types of attitudes that we kind of need to address. And then in regards to shelters, 61.6% of the LGBTQ community, they were denied access to shelters because of the fact that they do not fit the quote unquote typical victim of an IPV individuals. So what I have is on the next slide, I have a little bit of community resources listed. So I have the National Domestic Violence Hotline as well as the Audre Lorde Project. Both of those are very good for domestic violence and IPV. The Lambda GLBT community service and the rest of them listed further down are all specifically towards the LGBTQIA community. So I have the National Coalition of Anti-Violence Programs, the National Gay and Lesbian Task Force, as well as Trans Life. So all of those resources are available to the community. And as a mental health clinician, it's very imperative that we understand that these sources are also available to the LGBTQ community. And now I'm going to turn it over to Carly.
Okay, so I will be focusing on family history and substance abuse, and basically how that will impact obviously in the moment, and then current or future relationships and current relationships as well. So substance abuse obviously impacts the family as a whole, like the immediate family, but it's also going to impact like different family structures, and also it's going to extend just beyond the nuclear family. So extended family members, cousins, aunts, uncles, grandparents, they're all going to be impacted by a family member's substance abuse, not just the people that are living in that household. People in the household, they're gonna, experience the strain on the relationship because of it. If there's children, there's gonna be a lack of care from the parents. Rules or boundaries may be broken all the time or really not even established in the first place. And really there's just gonna be an overall lack of a parental figure. Of course, that's gonna be different in every situation. If it's a two-parent household and one parent is using a substance, then that's going to play a different role than if like both parents were using, or if it was just a single parent household. In the example with like two-parent household and one parent is using the substance, then basically what can happen is the parent that is not abusing the substance can basically overcompensate for the other parent in the parental duties. They also may feel guilty that the child has to, watch the other parent go through using a substance. So they may, everyone's a little bit different, but they may buy them extra gifts or spend extra time on them. They might be overbearing, trying to make up for the other parent's lack of parental duties and parental involvement than what they feel that they should be getting. Of course, the children and the spouse or partner may also be exposed to different forms of abuse from the substance abusing parent. They can experience things, a wide variety of things, but such as like anxiety, depression. Their, children aren't going to learn very good communication skills on how to, express themselves in a healthy way. Going back a little bit to like the extended family members getting affected as well. So they might feel a wide variety of things, seeing their family member abuse a substance as well. They might feel abandonment, anxiety as well, fear for that person, fear for their family, what might happen to the kids if there's kids in the household. They may also feel embarrassment, and that can also lead to them possibly wanting to cut ties with the family member. Or also, depending on the situation, they might want to take legal action as well. And, cut ties that way, or just put extra protection between them and that family member. Children can also act as like a surrogate spouse for the parent that abuses the substance. So they could step in and start helping the other parent with things around the house. I'll talk about it a little bit more also in one of my other slides about how they can step in and basically take the role of the other parent and what that can do to them. But really in general, like the intergenerational effect of substance abuse can have a negative impact on a wide variety of different things in relationships. So that can be like trust, role modeling, and really just having a concept of what normative behavior should be. They don't have that demonstrated. And then of course, that can also lead to, let's see, like the child, so that was with the double parent child or the double parent household. However, when it's a single parent and there's a child or multiple children, the older child normally has to step up and they take care of the other kids. They might have to, get them ready for school, bathe them, make sure they have food. Depending on the age, they might be the ones that are primarily in charge of doing like the grocery shopping, for example, or something like that, just to keep the household running. Substance abuse can really have like a long life effects on family members, especially children that are exposed to it. So substance abuse or substance usage during like pregnancy, for example, can cause a wide variety of difficulties for that child. Cognitive ones, they can have, develop different cognitive disabilities when they are born, and then this is going to have to be something that child and the family are going to have to handle and cope with throughout their entire lifetime. Children who also have a parent who is using illegal drugs, for example, they may be exposed to illegal activities, but this can also lead into them potentially having to engage in illegal behaviors on behalf of the parent. An example that I found was, they might have to, if the parent isn't stepping up and providing food, for example, they may have to steal food, or the parent might want them to like steal money for them or for food so that they can take care of the household or help them get the substance that they may need. So this is where I was kind of talking about a little bit ago, where children may be expected to take on premature responsibilities. So for example, if the mother of the household is using a substance and there's like a younger daughter, then the daughter may be expected to jump in and take the role of the mother. So she may be the one in charge of cooking, cleaning, and taking care of any other young children in the house. But that, of course, can basically strip her of her childhood because she has to step up at such a young age to take care of the household. And then, of course, children growing up in a family with substance abuse, they, of course, have an increased chance of substance experimentation in their adolescent years. And then it also has an increased chance for substance abuse in the future or developing one in adolescent years and just having that continue on into adulthood. And then if I can get the next slide. So there are different interactional patterns in families that have been identified in families that have a member or members that abuse a substance. So the first one, the negativism, this is essentially an interactional pattern in a family that's just focused on negative communication. So even compliments are put into a form of a negative compliment. And really it's just any way to get attention is to create a crisis. And normally the vibe of the household is negative, which may also enforce the substance use. The next one is parental inconsistency. This one, basically the rule setting in the family is erratic. There's inconsistent enforcement. The family structure is inadequate. It's just kind of all over the place. This causes children to become confused. They don't understand the right or wrong boundaries, and they can't predict their parents' basically outcomes of their certain behaviors, which can cause them to have a lot of anxiety. They're not really sure what they should do. And a lot of the times they act out to get their parents to set boundaries. The next one is parental denial. This is if a child has a drug abuse problem. And this is basically their parents, regardless of the warning signs, they do not want to believe it. That's not my child. There's no way they could engage in that behavior. That type of thought is there. The next one is a miscarried expression of anger. Children or parents who resent their emotionally deprived home and are afraid to express it, they are at a risk of using substances to basically manage their anger. So they really don't want to talk about what's going on at home, so they're going to use a substance to mask all of that. That ties into the self-medication, which is the next one. Basically, they're just using the substances to not deal with their thoughts and their feelings. The last one on there, unrealistic parental expectations. This is when parental expectations are realistic, either too high or too low. When it's too low, children can excuse themselves from future expectations, saying things like, you can't expect anything from me, I'm a junkie, I'm an alcoholic, that type of thing. If it's too high, the child may find themselves overcompensating in everything or doing so much stuff and reaching all these achievements that they still just feel that whatever they do is not good enough. And the next slide, please. So basically in the impact of substance abuse in romantic relationships, there's quite a bit. A main one is economic and of course psychological. A lot of the money that is made in the relationship is spent towards the substance, which can cause the spouse, if only one is using, to be strained with money or worry about money. Of course, there's a handful of psychological concerns that can arise from substance abuse, anxiety, stress. The non-abusing partner may feel hopeless, neglected from their partner. They may feel that like whatever they do is just not good enough to help them. Also then at this point, codependency often arises for the non-substance abusing partner. They may become overly concerned of the needs of the substance abusing partner, that they completely just put all of their stuff off to the side and they just focus on that individual. But they can show different signs such as controlling, they may have low self-esteem, they're excessively compliant, they may be loyal to people who they shouldn't be loyal to, but they're just so used of being basically putting all their stuff aside and doing whatever that other person needs. And then of course, substance abuse in the relationships, it can be an increased rates of violence, the interpersonal or the IPV, divorce rates are higher. There's adjustment disorders that are also pretty common in individuals who were raised in a family with substance abuse. And then of course, a handful of the mental health disorders as well. And then I will pass it on.
Okay, so I'm going to be covering the impact of physical abuse in romantic relationships. Like more of IPV, but I guess like more in a broader sense. Okay, I apologize for the slides, how the format came up. But basically, these are the prevalence of intimate partner violence amongst men and women in regards to ethnicity. So American Indian women have the highest rates of intimate partner violence with 51%. Then you have American Indian men with the highest rates amongst men at 43%. Next is Black women with 41%. Then Black men at 36%. White women at 30%. White men at 26%. Hispanic women at 29%. Hispanic men at 27%, and Asian and Pacific Islander women at 15%, and Asian and Pacific Islander men at 11.5%. And this data is from the CDC from 2014. And I will also be discussing a little bit more about like the cultural considerations of intimate partner violence. If I can get the next slide. So the impact of physical abuse of intimate partner violence is, so there are physical ailments of intimate partner violence, such as bruising, broken bones, headaches, and there's also a link between the development of chronic diseases, such as diabetes, asthma, and digestive diseases. And there's also financial intimate partner violence can impact survivors financially. The physical abuse can lead to psychological distress, making it hard to concentrate at work. That can affect the survivor financially. And also because the abuse and the psychological distress, many survivors may want to take days off from work to alleviate stress, and that may also impact the survivor financially. And also, of course, psychological distress. Many survivors develop PTSD symptoms, lower levels of self-esteem, higher levels of anxiety, personality disorders, and depression. Next slide. So these are the risk factors for victimization and the risk factors for perpetrators. And a lot of the risk factors for victimization and perpetrators are similar. Both victimization and perpetrators are likely to have a history of witnessing intimate partner violence, childhood maltreatment, mental health issues, and under the age of 25, attachment issues, insecure attachment, especially, and disorganized attachment. And there's some kind of economic dependence between the both of them. And also with perpetrators, there is this strict ideal of male dominance and aggression in relationships, and the desire for power and control in relationships. Diversity considerations of, that affect people that, that people that are in intimate partner violence that, may affect their reporting or may affect whether they want to stay, include institutionalized racism. My dissertation is about African-American women in intimate partner violence relationships. And one of the things I'm noticing in my dissertation is that those who kind of endorse like negative stereotypes about African-American women that justifies abuse that justifies the abuse of African-American women. And also another thing that can affect intimate partner violence relationship as far as reporting is being seen as a traitor to the community. A lot of people of color, especially like dealing with like different legal systems, they may not want to put their, their culture or their community, they may not want to put them in a bad light as far as like the legal system. So they may feel hesitant to go to the legal system or go seek social support as far as their intimate partner violence, because they may be seen as a traitor to the community. And another thing, another diversity consideration is gender, kind of like what Heather was talking about before with same-sex couples. A lot of male victims, they're not taken seriously in regards to intimate partner violence, especially if the perpetrator is female. And also with religion, a lot of couples that may, really identify with their religious belief may be afraid to leave the relationship because the taboo of divorce. And also with sexual orientation, you know, there are same-sex couples that are in intimate partner violence relationships that may not be out to their family and friends, and that may be used as leverage to the perpetrator. And you know, they may be afraid to report their you know, what is going on in their relationship, as because they do not want to you know, out themselves if they haven't, you know, come forward with like their family and friends. And with income level, you know, the victim of the physical abuse may have, you know, financial dependence on the perpetrator, and they may also be like hesitant to come out about like the physical abuse that's happening in the relationship. And also too, there is research about a lot of victims of intimate partner violence that if like when they leave the abusive relationship, those who are solely you know, financially dependent on their on the perpetrator, and they leave the relationship, it's sometimes is a gateway to homelessness. So that may be you know, that may be a hesitation why some of them may not report. And then also difficulty to access resources at for those that are low income. And with immigration status, those being afraid, like if they report, if they come forward with intimate partner violence, they may be deportated, and there's not like a lot of resources available for like different languages, or they may not speak the languages, they may not speak, you know, English, and you know, the translation, the different the difference in like culture may affect them for getting like the support that they need. And the same with like disability, as far as like income level, they may be like very physically dependent on the perpetrator for survival. And there's also like a lack of resources for those who are disabled and are in an intimate partner violence relationship. And then I can get the next slide. So.
Listen, about 1 more minute, because we still have.
Oh, sorry. Okay. So for the protective factors for intimate partner violence, social support and social connectedness. So, you know, a characteristic of intimate partner violence is like the perpetrator like isolating the victim from, you know, their community, their social support. So, you know, those who have a great social network, it serves as a good protective factor for intimate partner violence. And also like self-perceived strength, like I mentioned, economic issues really kind of, or economic issues affect the decision of people that are in intimate partner violence. And then another protective factor is spirituality and religion. For those who are, you know, very spiritual and religious, that kind of goes along with the strengths of like optimism. That's been found to be like very effective as far as, you know, intimate partner violence. And then mental health, because a lot of like the risk factors I mentioned, had to do with, mental health issues, like unresolved mental health issues, unresolved like trauma. So having having a good mental health intact is also a good protective factor for intimate partner violence. Yeah.
Thank you.
Hi, I am Ebony, and I will present some pointers on unresolved mental health factors and their impact on relationships within the Black community. I will go over a few statistics. Rates of mental illnesses in African Americans are similar to those of the general population. Only 1 in 3 Black or African American adults who need mental health care receive it. Compared with non-Hispanic whites, African Americans with any mental illnesses have lower rates of any mental health services. They are less likely to receive guideline consistent care, are less likely included in research, and are more likely to use emergency rooms and primary care rather than mental health specialists. Next slide, please. All right, so I used a quote, so much of our personal pain, family frustrations, and struggles as a community can be traced to unspoken and unresolved pain and trauma. So some components are experiences such as family, jobs, daily obligations, and hardships. They often have influences on the mental health state of African Americans. Finding meanings such as the cultural interpretation and also intergenerational coping strategies that are passed down. When it comes to experiencing symptoms and feelings, the ability to identify and acknowledge those feelings, acceptance, and also seeking help. Terminology, so being able to label those feelings and describing symptomization. Next slide, please. So next we're going to talk about the impact of vocabulary and communicative resistance. I don't know if the slide froze, but I will keep going. Cultural vocabulary references, such as having the blues, being down and out, and going through a bad patch, can impact the way that it's viewed. Sometimes vocabulary can be discouraging to keep someone from expressing themselves, such as being crazy, sensitive, or weak. So it's very important to keep that in mind when thinking about how it is viewed within the African American community, and also communicative resistance, such as I'm fine, or I'm just going through a phase, or I don't have time for this, or it's not that serious. You will often see that. The next slide will be addressing and discussing mental health within relationships. So African American practitioners have recommended the ABCs of support to be an effective start, and this will be the close of it. Assume that you can help, be a good listener, counsel your judgments, and be kind and acknowledge emotional hurt. And
Wow.
so we can discuss more in the breakout room. So sorry, I could cover more details in the breakout room.
You know, whenever I have students present, I feel like this proud mommy moment, right? And so I always get so much prideful. And Dr. Canillas every year brings the students and integrates them and makes them cohesive, and every year you're like, what's the topic? What's the theme? Okay, I'm going to make that work. And you always make it work, no matter what I throw at you. So
yes,
yeah, it's amazing, right? And so I just thank you guys for coming. You were the only student team besides Dr. Kennedy's that we had this year. Everyone is volunteering. Yeah.
Okay.
Yeah.
Well, that's good.
Yeah.
I think they did a great job.
Yeah. Oh, yeah. That's how much trust I instilled in you guys. So I am just honored and thank you. You did it. You broke it down. So